Our topic is all about students with speech and language disorders. Speech and language disorders refer to individuals who experience difficulties in their ability to produce speech sounds accurately or fluently, understand language, or use language appropriately for communication. Now, let's have the basic concepts on communication, speech, and language. The concepts of communication, speech, and language are interrelated. Speech and language are the key components of communication. Basically, communication takes place when both the sender and the receiver of the message use common speech patterns and language. Difficulties in speech production and lack of language skills interfere with effective communication. Nevertheless, these concepts have their respective definitions, descriptions, and uses. Speech and language disorders cause problems in communication. In the United States, it is estimated that 5% of the school population has communication disorders. In the Philippines, the incidence of children and youth with communication disorders may be higher. Let's talk about communication disorders. Now, what is a communication disorder? Communication disorder is an impairment in the ability to receive, send, process, and comprehend concepts or verbal, nonverbal, and graphic symbol systems. A communication disorder may be evident in the processes of hearing, language, and/or speech. A communication disorder may range in severity from mild to profound, and it may be developmental or acquired. Individuals may demonstrate one or any combination of communication disorders. A communication disorder may result in a primary disability, or it may be secondary to other disabilities. Here are the three types of communication disorders. The first one is the speech disorder, second one is the language disorder, and lastly the hearing disorder. Now, what is a speech disorder? The most popular definition of speech impairment or disorder is the one by Van Riper, which states that speech is abnormal when it deviates so far from the speech of other people that it calls attention to itself, interferes with communication, or causes the speaker or listeners to feel distressed. Any deviation in the condition of breathing and voice-producing mechanisms, including the integrity of the mouth and oral cavity, can cause speech disorders. There are speech-related problems that cause ineffective communication, like problems in voice, articulation, and fluency. Voice disorders are deviation in phonation, such as in pitch, frequency, and quality. Speech can be hoarse or may lack appropriate inflection. Vocal resonance is affected by impedance in the flow of air. Hypernasality results when there is too much airflow and the voice seems to come from the nose, or in the case of hyponasality, the airflow is too little and the voice seems to be impeded by severe cold. Articulation disorders are errors in the formation of speech sound. Toddlers who are learning to talk and young school children who have to deal with new communication experiences often exhibit wrong articulation or utterance of speech sounds. Before long, they outgrow the inability to say and read words and sentences correctly. Fluency disorders interrupt the natural, smooth flow of speech with inappropriate pauses, hesitations, or repetitions, unlike normal speech that makes use of rhythm and timing, so that words and phrases flow easily. Fluency disorders are characterized by unnatural variations in speed, stress, and pauses. Cluttering and stuttering are examples of fluency disorders. In cluttering, speech is very fast with extra sounds and mispronounced sounds that make speech garbled and unintelligible. Stuttering is marked by rapid-fire repetitions of consonant or vowel sounds, especially at the beginning or words and complete verbal blocks. The cause of stuttering is unknown. It is a disorder of childhood that appears between the ages of 3 to 5 after the child has acquired fluency in speech. The condition is more common among males than females and occurs more frequently among twins. It is situational and appears to be related to the setting of circumstances of speech.
Language disorder. The American Speech Language Association, or the ASLA, defines language disorder as the abnormal acquisition, comprehension, or expression of spoken or written language. The disorder may involve some of the phonological, morphologic, semantic, or pragmatic components of linguistic system. When we say phonological, it refers to the sound system of the language, and difficulties in this area may manifest as problems with speech, sound production, or recognition. Morphologic, it deals with the formation of words from morphemes. Difficulties here may involve challenges in understanding or using prefixes, suffixes, and other word parts. And semantic pertains to meaning of words and sentences. If this component is affected, the individual may struggle with understanding the meaning of words or interpreting sentences correctly. Last is the pragmatic. It involves the use of language in social contexts, such as understanding and using appropriate social cues, taking turns in conversation, and understanding implied meaning. Difficulties in this area may result in challenges with social communication and interaction. So, children with language disorder manifest delays or lags in language development. They lack age-appropriate language comprehension or receptive and expressive abilities in the basic facts of communication, namely listening, speaking, reading, and writing. However, a child who has a language delay may not necessarily means that they have a language disorder, because a language disorder delays implies that a child is slow to develop linguistic skills but may acquire them in the same sequence as normal children. Children with language disorder may have trouble understanding and using language in listening, speaking, reading, and writing. And it is also important to note that the language delay, where a child is slower in developing language skills, is different from language disorder. Because language disorder, it is a disruption in the typical rate and sequence of language development milestones. So, here are the following factors contribute to language disorders in children. So the first is cognitive limitation or mental retardation. The second is the environment deprivation. The third is hearing impairments. Fourth is the emotional deprivation or behavioral disorder. And the last is the structural abnormalities of the speech mechanism. So, all of these factors can lead to delayed, disordered, or absent language development in children. So also, the adults play a crucial role in supporting children's language skills. Positive reinforcement such as praising children from good communication can encourage language development. Conversely, negative feedback like discouraging children from talking or not engaging in conversation with them can hinder language development. So this lack of motivation at home can lead to problems with language form, content, and use. So the form problems, it covers the phonology, morphology, and syntax problems that range from difficulty or decoding spoken language, abnormal use of prefixes, to abnormal structure of words and wrong use of tenses. So, this can include difficulties in understanding and using speech, sound, word structure, and sentence structure. This can range from struggling to understand spoken language to using words and sentences incorrectly. Content problems. These include semantic disorders manifested in poor vocabulary development and appropriate use of words and poor comprehension of the meaning of words. So, this involve difficulties in understanding and using words correctly. And the last is use or pragmatic problems. It covers the inability to comprehend or use language in context or conversation and various situations. So, on the other hand, it refers to the challenges in using language effectively in different contexts or conversations. So, here are some examples of the language disorder. The first is the central auditory processing disorder. This is when there are difficulties processing sounds, often linked to hearing loss or intellectual capacity. So, example for this one is trouble distinguishing similar sounds like cat or bat. Next is aphasia, a language disorder resulting from damage to parts of the brain responsible for language. And the example for this one is difficulty finding the right words to express thoughts and challenges in reading and writing. The next is the aphasia, or it is a verbal aphasia or dysprasia. It is a condition where a child has trouble articulating words correctly and consistently. And the example for this one is inconsistent speech, sound errors, struggles with the rhythm and intonation in speech. And the last one is dysarthria. It is a speech condition where weakened muscles in mouth, face, and respiratory system affect oral language production. Example for this one is the slurred or slow speech and weakness in facial muscles affecting speech articulation. So, the speech and language disorder that result from hearing impairment, it is the persons who are deaf or hard of hearing manifested speech and language disorder as a result of conductive, sensorineural, auditory nerve, central auditory nervous system, and functional hearing losses. Deafness restricts the perception of the sound elements of a language and other sounds in the environment with or without a hearing aid. So the greatest impact of deafness lies in the acquisition of speech and language skills. So, speech and language disorders resulting from hearing impairment can significantly impact language development. Deaf and hard of hearing involves may experience difficulties in perceiving language, sounds, and other environmental sounds. Depending on the type of hearing loss, such as conductive or sensorineural, the acquisition of speech and language skills can be greatly affected, while individuals with a hearing impairments can develop communication skills through sign language, gestures, or auditory training. These methods may not fully compensate for normal speech and language development.
And now, let's proceed to the assessment.
So now let's proceed to the etiology of speech and language disorder. The cause of speech and language disorders are complex. When we say complex, it is consisting of many different and connected parts. So, next, the cause can be functional like environmental stress and can also be organic in the case of cleft palate. So, environmental stress, it refers to a negative subjective psychological response to an environmental stimuli, while cleft palate is an opening or split in the root of the mouth that occurs when the tissue doesn't fuse together during development in the womb. It often includes a split in the upper lip but can occur without affecting the lip. So, sa tuwa, mao ni siya ang bungi. So, bungi ni siya sa ato ang term. Then, the cause can be congenital when the disorder is present at birth or in infancy, early childhood, and in the later years. So factors contributing to these disorders include brain damage, mental retardation, hearing loss, ADHD, learning disabilities, autism, schizophrenia, cerebral palsy, cleft palate, vocal cord injury, disorders of the palate, and Gilles-de-la-Tourette syndrome. So injury, incidents, diseases, and trauma can lead to childhood aphasia or loss of language functions, with left hemisphere damage causing more significant language disturbances. Conditions like meningitis can result in complications such as hearing loss and other related issues. Incidence and prevalence. So speech and language disorders are prevalent, with approximately 20% of children in special education in the US affected by these disorders. So at least 5% of school-age children have speech and language disorders, with 3% having voice disorders and 1% stuttering. The incidence of articulation disorders in school children is 2% to 3%, but this percentage decreases with age. So now let's proceed to the learning and behavior characteristics. Children with speech and language disorders experience difficulties in both receptive and expressive language. So when we say receptive language, it refers on how your child understands language, while expressive language refers to how your child uses words to express himself or herself, impacting their ability to understand, use spoken communication. And this includes trouble following directions, improper word usage, and difficulty in expressing ideas. Receptive language deficits hinder their ability to express thoughts, respond to questions, and engage in abstract activities, while expressive language deficits affect grammar, syntax, fluency, and vocabulary. These disorders often accompany other disabilities such as ADHD, autism, and cerebral palsy, and negative impact cognitive functioning, social interaction, and behavior. So the affected children show low academic performance due to struggles with organizing ideas, following directions, and recognizing phonemes. So socially, these children often withdraw from interactions due to feelings of exclusion and frustrations, further hindering their social development.
And now, let's proceed to the assessment procedures. First, we have the pre-referral intervention. A teacher nomination form is accomplished, scored, and interpreted to a child who manifests at least half of the characteristics of speech and language disorders is recommended for screening. The special education teacher conducts the screening process by using a checklist of characteristics of children with speech and language disorders, by observing the child's communication skills in the formal setting and informal setting, in the playground, canteen, and similar places. The pupil and the parent or caregivers are interviewed to validate the results of the nomination form and checklist. The findings are compared to the normal characteristics of speech and language development indicated in the milestone on language development to determine the delays tentatively. Next, we have the multi-factored evaluation. Special education teachers, especially those who are trained to teach children who are deaf, are called to administer several assessment tools to determine the presence of speech and language disorders. By comparing the child's receptive and expressive language levels to his or her mental age, differentiation between a language problem and a developmental delay can be made. An effective language assessment is done carefully, not thoroughly and carefully. As soon as possible, formal evaluation by a speech pathologist is arranged. While waiting for this opportunity to come, special education services are given to those students as remedial and preventive measures. And now, let's proceed to the educational programs. The American Speech Language Hearing Associations offers some suggestions for the regular teacher in an inclusive class and for the special education teacher as well. First, introduce changes in the home and school setting, especially if the child has central auditory processing problems. To help the child focus and maintain attention, give him or her a seat that is away from the window and away from auditory and visual distractions. A seat close to the teacher and the blackboard away from the window or the door may be helpful. Next, reduce external visual and auditory distractions. A large displays of posters or cluttered bulletin boards can be distracting. You should provide a child with a study carrel. Earplugs may be useful to block distracting noises. Check with an audiologist to find out if the earplugs are appropriate and which kind to use. The third one of the educational programs is to improve the listening environment. The following rules are helpful. If the teacher is speaking in front of the class, first, you should gain the child's attention before giving directions. Next, speak slowly and clearly but not over-exaggerate speech. The third one, you should use simple, brief directions for it to be easier to understand. Fourth one, you should give directions in a logical, time-ordered sequence. Use words that make the sequence clear, such as first, next, and finally. The fifth one, you should use visual aids and write instructions to supplement spoken information. Next, emphasize keywords when speaking or writing, especially when presenting new information. Next, you should use gestures that clarify information for them to understand. Vary loudness to increase attention. Next, you should check comprehension by asking the child questions or asking for a brief summary after key ideas have been presented. Next, you should paraphrase instructions and informations to shorter and simpler sentences for them to be easier to understand. Next, you should encourage the child to ask questions for further clarification. Make instructional transitions clear. Review previously learned material. Next, recognize periods of fatigue and give breaks as necessary. Avoid showing frustrations when the child misunderstands a message. And lastly, you should avoid asking the child to listen and write at the same time for children to severe central auditory processing problems.